let's talk about the crooked nose, septal deviation. What do you do for that? How do you know how bad it is? And how do you know how to attack it?
So septal deviation is one of the areas where the nose can be blocked that we've got a really tried and true algorithm. It's one of the most common surgeries that's done in ENT. Usually what we do is when we see a patient that's got a bad septal deviation, you can identify it right away, you can identify their problem, they can tell you, hey, my left side's bad. Oftentimes they have a trauma history, although not always a bad one. You know, it's not always a boxer. Oftentimes it's just somebody that one of their kids when they were growing up bonked them in the nose playing or something. And so the septum is cartilage, so it's pretty easy to break. And so we look in, we see it, and we say, hey, I think a surgery would be the most helpful thing for you here. There's not really a great way to address the septum without trying to straighten it.
So how do you straighten out the septum? Since you've got bone up on the top and you've got cartilage in the middle, what do you do?
So you go in through the nose, there's no cuts on the outside of the face, no one can tell you've had the surgery. We traditionally do these asleep, although there are some people that prefer to do them awake with local anesthesia, which is an option. But you make a little cut on the lining of the nose, you lift the lining up until you can see the cartilage, and then you can strategically look and see, okay, here's a bend here and a bend here. You take out the bend parts, sometimes you can straighten pieces and put it back in, or sometimes you just leave kind of the framework behind. As long as you leave a little bit of support, the nose will behave just normally, even without the deviated parts.
So when you do that correction, which sounds so simple, and I know it's not simple like that, what kind of results do you get?
So septoplasty is a very effective intervention, very low risk and very high rate of success. So 90% or greater of patients will have a significant demonstrable effect or improvement in their nasal breathing.
So if somebody's got a crooked nose, we can fix that.